Welcome back to Close Up and one of our full Senator shows with our guest this morning, Senator Maggie Hassan. Thanks for being here, Senator.
Thank you for having me.
So as we noted off the top of our show, this is the midway point of your first term in the Senate. What are we going to see you focus on in the 3 years ahead? Well,
what I continue to focus on is expanding economic opportunity for all Granite Staters and Americans. That includes lowering health care costs, which is critical in that effort and critical to individual families and businesses. It's also important we continue the fight against our opioid epidemic. Now we also see a new epidemic with vaping, something that I just addressed this last week in one of our committee hearings. It's also critically important to continue to support our veterans who sacrifice bravely for us, and we can never fully repay their sacrifice, but we've got to keep at it. And lastly, and most importantly, keeping our nation safe, secure, and free. So that's the way I see my job. Those are the priorities we need to continue to address, whether it's efforts on workforce training with my Gateway to Careers Act and a bill I just introduced, another bipartisan bill, the Fast to and Through College Act for students, whether it's continuing to improve our resources to prevent and treat addiction, whether it's dealing with challenges on health care costs. We have to end surprise medical billing, and I've been working with Republican Bill Cassidy from Louisiana to do that. We've got good bipartisan support on that. And we actually passed a bipartisan bill out of our Finance Committee to lower prescription drug costs. That's something that we need to continue to work on. And lastly, I'll continue to call on Senate Majority McConnell to bring some of the bills that the House has passed to the floor of the United States Senate. We have been waiting to reauthorize the Violence Against Women Act, which the House passed some time ago. That brings critical resources to the fight against domestic violence and sexual assault, for example. We have work to do on election security. The House passed a critical package there. It hasn't come up for a vote on the Senate floor. And we know that, we've just had yet another school shooting, and my heart goes out to the victims and their families and to everybody impacted by that horrible event. But Americans support common sense gun safety. There is a bill that the House passed that would provide universal background checks, something that 90% of Americans agree we should do. That's waiting for a vote on the floor of the United States Senate. We need to start legislating again and listening to the people we represent and solving problems just the way the people in New Hampshire do.
You mentioned vaping back there. E-cigarette use in New Hampshire, according to a new study, is amongst teens is the highest in the country. Kind of shocking.
Yes.
What resources can be provided to school districts to try and get out ahead of this?
Well, we certainly need educational resources so students understand that these e-cigarette products have nicotine in them and that nicotine is highly addictive. But the report was very, very concerning. We have the highest rate of daily vaping by teenagers in the country. And the other statistic that really stunned me was that the American Academy of Pediatrics says that only 4% of teens who get addicted to nicotine are going to be able to kick that addiction. That's really serious. So we just had a hearing last week in our Health Committee. The FDA and the Trump administration have still not taken a position on what they're going to do in terms of banning these flavored e-cigarette products that are so attractive to teenagers, and cracking down on the industry generally. In the meantime, though, we need to get resources to schools so that students understand that e-cigarettes and vaping are addictive, that students and adults, young people and adults, need to understand that they should not buy bootleg products because we're also seeing great harm done to people who may have vaped some adulterated product. We're not, the science isn't entirely clear yet, but we had the CDC before us too. But at the end of the day, people need to understand that e-cigarettes can be very addictive, that being addicted to nicotine is very hard to quit, and that the e-cigarette companies are trying to make a lot of money off of a teenage market, and that's unconscionable and it has to stop.
You mentioned healthcare as another priority. If we're dealing with a President Bernie Sanders or a President Elizabeth Warren in 2021, are you going to be a vote in favor of their Medicare for All plans?
You know, I believe healthcare is a human right, and I think every Granite Stater and every American needs to be able to get the right care at the right place at the right time. It needs to be affordable and high quality care. I have real concerns about any kind of Medicare for All proposal for two reasons. One is cost, and the other is disruption. It is very hard to move to an entirely new system without the kind of disruption that can really undermine our healthcare system and hurt individuals who need care, especially people with complex medical needs. So what concerns me in the whole discussion that we've been having is that people have been focusing on the differences that Democrats may have about how to get to universal coverage, something we all believe in, as opposed to focusing on what the Trump administration is doing as we speak to undermine our health care and return us to a time when insurance companies could discriminate against people with pre-existing conditions, for example. People need to understand that not only did the Trump administration and Republicans in Congress work to repeal the Affordable Care Act, and your viewers will remember that back in July of 2017, they lost that effort to repeal the Affordable Care Act by one vote. Had they been successful, there wouldn't be protections right now for people with pre-existing conditions, for example. But they weren't successful. But they didn't stop there. Instead of listening to the American people who came to the Capitol in droves, who came to the state capitol here in New Hampshire to tell us how important their health care was to them and to tell us that they didn't want to go back to a time before the Affordable Care Act, instead of listening to them, the Trump administration then joined with state attorney generals and went to court. And they are currently trying to get a court to invalidate the entire Affordable Care Act, which again would return us to a time when people with pre-existing conditions couldn't get coverage, couldn't get health care, when you could have a lifetime cap on your health care benefits no matter how much you paid your insurance company over a series of years, and could return us to a time before Medicaid expansion, when people couldn't get treatment, for instance, for substance use disorder. We've seen how important the Affordable Care Act and Medicaid expansion, a part of that act, is to our own fight against the opioid epidemic here in New Hampshire. So the Trump administration is actively trying to invalidate all those improvements that we made to the healthcare system, and at the same time, they are also pursuing a regulatory agenda which hasn't gotten a lot of coverage, which allows these junk insurance plans, for instance, to be sold to unsuspecting consumers who think that they're decent insurance plans and they're not. So we really need to be focusing on the fact that Democrats stand for covering everybody and Republicans are trying to take health care away.
You mentioned, well, you put out a warning essentially at the beginning of the open enrollment period for Obamacare. Right. About these junk insurance plans. Do you know of any operating in New Hampshire right now that people should watch out for?
I don't, but we will certainly get you that information. What we do know, though, is that just recently the administration has started putting out directives to people to redirect them to a website where private insurance agents who get bigger commissions from these junk plans than they would from selling plans consistent with the Affordable Care Act that have guaranteed benefits. The administration has been steering people to a different website where the insurance being sold is generally going to be more expensive for poorer coverage.
Okay, Senator Hassan, thank you for joining us.
Thank you very much.
An entire close-up show. We appreciate that.
Thank you. I really appreciate the opportunity.
We'll see you back here in a few months.